Swadikap, good afternoon. Friday, the 19th of March, 2021 today, and this is the English language briefing here at the CCSA. So firstly, thank you to both Drs. Tawisin and Dr. Penpapra for the Thai language edition of the briefing that we had today. This morning, we had the general CCSA meeting wherein the director of the CCSA or the Prime Minister chaired the meeting on various important issues. And I'll be recapping this for you in a short while. Firstly, the daily numbers and statistics for today. We have recorded for today 100 new confirmed cases in Thailand. Of that number, 41 are from active case finding, and 55 are from local transmission, and 4 others are from those who have traveled from abroad and entered the country, been placed in, directly into the state quarantine system. So that makes a total of 100 cases recorded for today. We have 73 new recoveries, and the total active cases currently in treatment in hospital now, as you can see on screen, is 1,054. Just mind you that this is the period that we still have the active case finding missions, particularly for the at-risk areas in Bangkok, particularly Bang Khae district, as you all know. So in the process of controlling that outbreak. So we have one new fatality to report to you, making the total number of those who have died from COVID in Thailand 90. So just some observations on the current trends of the COVID situation in Thailand. There continues to be a spike in the number of COVID cases at the local level and also in Thailand. But in Thailand, of course, it's because of the active case finding missions. Now, in Thailand, there continues to be movements still of those who cross the border illegally through the natural pathways, natural borders of Thailand. Which is connected to the COVID cases of those being detained as well in the immigration detention centers in Bang Khae and in Son Plu. So these are the source of some of the numbers that we have for today. Now, constant monitoring of people's movements across the border continues to be a priority for Thailand as we remain vigilant in this fight against COVID. Now, locally, the spread of COVID-19 is still found in Bangkok and 10 other provinces in the northeast and in the southern part of the country. The measures to stem the spread will now emphasize on control measures at wet markets and their surrounding areas, including measures in terms of temperature checking, hand washing, the use of all the applications. And of course, as you know, the vaccination programs will also focus on areas of Bangkok and Samut Sakhon province, aside from the other areas that we have prioritized. And I'll talk a little bit about that shortly. So this morning, the Prime Minister chaired the General CCSA meeting and discussed various issues of importance and finalized and approved many important issues. So I'll just recap this in five major points. Firstly, one, this year's Songkran festival next month will not include water splashing, powder smearing, that's tradition, and foam parties to prevent the risk of disease transmission. Instead, the Songkran festival in Thailand this year will focus on the traditional aspects of the festival, such as merit making, such as sprinkling water on Buddha statues, pouring water on the palms, on the hands of the elderly. You can see a graphic there on screen, and asking for their blessings of senior citizens. Of course, strict DMHTT measures need to be followed at all times during Songkran. So this was number one as approved and will be announced in due course formally by the CCSA, approved this morning. Number two, the use of the emergency decree will be extended as interagency cooperation and integration is still very vital, still very necessary in order for us to stem the spread of COVID in Thailand. Now, this will be the 11th time that the emergency decree has been extended in Thailand. And this will be effective from the 1st of April until the 31st of May 2021. Thirdly, the CCSA General Meeting approved for the relaxation measures in various provinces, including Samut Sakhon, that has been approved, and it means that the province of Samut Sakhar will no longer be designated as a red zone, which is the maximum controlled area with strict measures, but will now be in the orange zone where most economic and social activities can now be carried out. And as mentioned earlier, the recategorization of the various provinces has been approved and will be announced shortly, approved this morning. Number 4, the CCSA General Meeting also talked about the vaccination, inoculation program that have continued to go according to the plan in Thailand, with the first phase of the vaccine rollout to frontline health workers and at-risk groups due to be completed totally by October this year. But in the initial stage, 200,000 doses of vaccines are due to be given to people by the end of this month. And the programs are all inclusive, encompassing all groups of people in Thailand. Now, just a little bit of more detail on this. Dr. Tawisin mentioned this with a graph. You saw some pictures with the injection needles. So the Sinovac vaccine, which will total 2 million doses arriving and to be used between February, already used, until April of 2021. Now, tomorrow, there will be an additional of 800,000 doses distributed to various provinces, arriving tomorrow, and distributed to be inoculated in various provinces of economic importance. Now, 200,000 of Sinovac has already arrived, 800,000 tomorrow, and the remaining 1 million doses by April 2021. That makes 2 million doses for Sinovac. Now, in the month of June to August 2021, we'll be receiving in 3 tranches 26,000 doses of AstraZeneca. Now, this 26,000 will be divided into 26 million doses will be divided into 6 million in June, 10 million in July, and 10 million in August. And the last one would be the AstraZeneca, totaling 35 million doses between September to December of 2021. And this is 35 million will be broken down into 10 million doses in September, 10 million doses in October, 10 million doses in November, and the remaining 5 million doses in December. So as you can see, this plan that we are pushing forward has its own calendar and the number of millions of doses to be arriving in each particular month in order to cater to the various target groups that we have for the inoculation. All the way from February last month, March now being inoculated, all the way until October, then December of this year. In 3 big tranches, Sinovac, AstraZeneca. Sinovac 2 million, AstraZeneca 26 million, and AstraZeneca 35 million. So another important issue, which is number 5, which I'm recapping for you from the CCSA General Meeting. Number 5 is on the relaxation of quarantine measures. So the mandatory 14-day quarantine for those entering Thailand has been approved to be reduced to 10 days for people coming to Thailand from countries with no cases of COVID variant strains. So from those coming to Thailand in the future from countries with COVID variant strains, the 14-day quarantine will remain. But for those who come from countries without this strain, it would be reduced to 10 days quarantine as opposed to the 14-day previously. Now, just a little bit of detail on that. So the scenario from people coming from countries with the variant will be quarantined for 14 days in order to prevent the spread of the variant strain of the virus in Thailand. And this group would have to take the RT-PCR test for three times. Now, the second scenario is, of course, for those who travel from countries which do not have the variant strain. They will be required, aside from the documents and certificates, required to test RT-PCR for 2 times and be quarantined for 10 days. Now, that being said, I have to mention that this will depend according to the situation in due course at that time, whether or not there will be an internationally recognized standard for vaccination as approved by the World Health Organization. And the list of countries for the first group, countries with variant strains, of course, that will be is to be determined. But basically, there are these two groups, which we'll have to see according to the situation. But in principle, it has been approved by the CCSA meeting this morning for people arriving from countries without the strain to reduce their quarantine period to 10 days. Now, just some additional information that for those who do not come from countries with the variant strain, the first part of it is, the first phase is April to June. So for those coming from countries without the strain, that will be 10 days, and then 2 times of RT-PCR testing. The second phase, we will divide it into the second phase, which is July until September. The same type of criteria will apply for those coming from countries without their variant strain. But we divide this into 2 periods, immediate periods, April to June 1, and then the second phase is July to September, in case that we would have to adjust this measure, or the number of days, or the measures that we have to apply to those coming from various countries. So just in those 2 periods, but basically 10 days for those who come from countries without the strain. Now, from the period of October the 1st, 2021 onwards, for those coming from countries without the variant strain, possibly there will be no quarantine from the 1st of October, according to the criteria that we have, will be setting by that time, and of course the situation at that time. So looking forward to that, if the numbers don't get that high, those coming from many countries will be able to travel to Thailand, firstly with the 10-day quarantine, and by October the 1st with no quarantine at all. So this has been approved in principle this morning. So just some additional information. Firstly is the organizational quarantine along the border. The government spokesman said that the cabinet approved a budget of 438 million baht to create 14 organizational quarantines, or OQs, along the border facilities for migrant workers and those who cross the border illegally. Who have been arrested in 7 provinces. So that's Tak, Mae Sot District, Chiang Rai, Ranong, Songkhla, Chantaburi, Sakeo, and Nong Khai provinces, including preparing field hospitals in case of health emergency, which will be operational from April until September of this year. Now, this is set up because of the fact that there remains people traveling into Thailand illegally through natural borders, as you can see on screen, through forests or rivers, which we would have to take very strict enforcement. But when they are arrested, they will be placed into these organizational quarantine at the border facilities. Another piece of information is about the test project on the immunity among people who have received Sinovac or AstraZeneca. So the Health Ministry will conduct a study on the vaccine efficiency among people who received Sinovac or AstraZeneca vaccines to learn more about their ability to build up immunity in the body. Results of the test project are expected to be known within the next 2 months and will help shape the government's vaccine policy as we go forward for the next 12 months. Now, Dr. Somsak Akasin from the Department of Medical Services said that the COVID vaccines could not guarantee lifelong efficiency, now that's a fact, to prevent further infection. So it is important for us to continuously learn more about the vaccine, such as through tests that I mentioned. And you have an infographic there on this launch of the test study campaign. Another information is about COVID sniffing dogs you might have seen in the news. So Chulalongkorn University's Faculty of Veterinary Science has released Thailand's first ever pack of COVID sniffing dogs, confirming that they are almost 95% accurate in identifying asymptomatic patients. Now, the Faculty of Veterinary Science said that since the dog's sense of smell is 50 times better than humans, Labrador retrievers were selected for training as they have long snouts and a good sense of smell and are friendly. So the 6 sniffer dogs were 94.8% accurate in sniffing out asymptomatic patients, stating that dogs were also being used to sniff out virus carriers in Finland, in Germany, France, and Australia. The researchers used the patient's sweat to train dogs, confirming that the entire process was safe. And there are also plans to, in the future, to train dogs to detect patients with other diseases as well. Now, this is all classified as innovation and things that we try to come up with in order to help in terms of the search, the identification of those who are at risk and things like that. So just another part of the effort that we're having in addition to the medical and scientific based measures that we have. So just in closing, the situation in Thailand continues to be under control. I can safely say that. So we'd like to thank all of you for your kind cooperation. Your actions are very important in the past and will continue to be important in the future, in the coming months in the fight against COVID. Your contribution is very important. We have quite an increase in the number compared to the past weeks, but they are, of course, from the active case finding. We have the vaccine detail rollout planned already in place. The Prime Minister took the shots already without any symptoms, and will continue to improve and adjust accordingly, according to the situation each day, finding innovation, finding new avenues, and continuing with our efforts to rid Thailand of COVID. Now, you can keep updated with the information around the clock on social media regarding the statistics and updates on various channels. That was on screen for you just now. The Facebook pages of PR Thai government, the Tourism Authority of Thailand, the NBT World page, the Bangkok Post, the Nation, and then Thai PBS World as well. So thank you very much for your attention. Have a very pleasant weekend ahead, and we'll see you next time. Thank you. สวัสดีครับ